Welcome back to Understanding Human Anatomy and the Brachial Plexus, Part 3. In the last video, I talked about the 5 terminal nerves of the brachial plexus: musculocutaneous, median, ulnar, radial, and axillary, and what they did, specifically which muscles they innervated. In this video, I want to look at smaller branches that come off the plexus at other parts. They come off the roots of the plexus, they come off the trunk of the plexus, or the chords of the plexus. So, what I want to start with is the long thoracic nerve. And the long thoracic nerve is formed by branches from the roots, beginning with C5, C6, and C7. And the long thoracic nerve passes down the lateral aspect of the thorax along with an artery, the lateral thoracic artery. And it is going to supply one muscle, and that one muscle is serratus anterior. So we have here the long thoracic nerve, supplying serratus anterior. Then we have a small nerve coming off of the C5 root, and I've got it here, and this nerve is the dorsal scapular nerve. Right there. The dorsal scapular nerve is the nerve supply to the rhomboids. Then we have a nerve coming off of the upper trunk, and this nerve is the suprascapular nerve. The suprascapular nerve passes through the notch, the suprascapular notch, and innervates supraspinatus and infraspinatus. Another nerve coming off of the upper trunk, and I'm going to draw it in here, is the subclavian nerve, also referred to as the nerve to subclavius. Subclavian nerve. And this nerve supplies the subclavius muscle. There are no more branches off the trunks and no branches off the divisions. When we get to the chords, branching from the lateral chord is the lateral pectoral nerve. The lateral pectoral nerve supplies the largest part of pectoralis major. Then branching from the medial cord we have a medial pectoral nerve, and the medial pectoral nerve supplies pectoralis minor, and then the remaining axons in the nerve pass through pectoralis minor and supply a small part, a relatively small part, of pectoralis major. Then we have two cutaneous nerves that branch from the medial cord. I'll draw them like so, and I'm drawing them at different lengths to allow to put their labels on. The first one I drew is the medial brachial cutaneous nerve. And the second one I drew, the medial antebrachial cutaneous nerve. And as the name implies, the medial brachial cutaneous nerve is going to the medial aspect of the arm. The medial antebrachial cutaneous nerve is going to the skin on the medial side of the forearm. Then we have some nerves from the posterior cord. And the first one I'm going to draw in here is the thoracodorsal nerve. And the thoracodorsal nerve is the nerve supplied to latissimus dorsi. And then we have two other nerves to draw in off of the posterior cord. One here and one here. And these are the upper and lower subscapular nerves. two nerves that together innervate subscapularis muscle. Those are all the small nerves from the brachial plexus. Now, the sensory innervation of the hand deserves some attention. And this is partially because the hand has fairly defined areas of sensory innervation, so one can test whether someone can feel in these areas and isolate it to one of three nerves from the brachial plexus: the median nerve, the ulnar nerve, or the radial nerve. So if we look at the palm, the palm view of the hand, or the anterior of the hand, we find that most of its innervation is from the median nerve. And I'll color that in blue. And I'll over here, because we're going to use the same color code on both hands here. This is the median nerve, cutaneous innervation to the hand in blue. The rest of the palmar surface is innervated by the ulnar nerve, and I colored that in green. And so let me label in green the ulnar nerve sensory innervation. If we flip the hand over, in other words, if we pronate it, or just look at the dorsal side or the posterior side, so this is a dorsal view on the right side of the screen, we find that the ulnar nerve supplies this area. It's the lateral half, except for up onto the upper half of the digits. And the dividing line is the middle of the third digit. The dividing line over here on the palm is the middle of the fourth digit. Then we have the radial nerve taking care of the lateral side of the dorsum of the hand, except for the upper halves of digits 1, 2, 3, and half of 4. So this is, in red, the radial nerve. Then we're going to find that the upper halves of the digits that are not supplied by either the ulnar nerve or the radial nerve are supplied by the median nerve. So we'll color those in blue. But seeing this, you can test fairly easily, over here on the lateral side or over here on the medial side. Same here on the palmar side. And it's much easier to distinguish which nerve if you're testing sensory capability. That completes our discussion of the brachial plexus. Thank you for your attention.